My name is Annapurna Kori under section NLM KDD Professor Donny Duncan. Today I am going to talk about reflection of week 2, week 3 and week 4, what I have learned during these weeks. So now I am going to talk about week 2 reflection. So in this week I have learned what is nursing informatics in contrast with the medical informatics. And when we talk about nursing informatics, it mainly focuses on the patient care, whereas medical informatics, it mainly focuses on overall health of the healthcare of an organization. And uh, and next thing I have learned is why the nurses require nursing informatics as a fundamental skill, because any graduate nurse requires to have a basic skills of nursing informatics in order to operate uh, electronic health records, where she can have access to the patient information, and it provides and she can provide better care to the patient. And when we come, and I also learned principles of this nursing informatics. There are mainly general principles like uh, like uh, like assessment, planning, outcome, diagnosis, implementation, and evaluation. By having these principles, the nurse can provide quality care to the patient. And by knowing nursing informatics, these nursing informatics helps the future nurse leader in helping having a better communication with the physicians and further treatment of the patient, and there won't be any delays in the patient treatment. And and can reduce medical errors, and it also helps in having quality care and patient safety. And now we are going to talk about what are the guidelines of CASNS includes. This is under week 3 reflection. In this week I have learned like how these guidelines helps nurses to improve patient care. So there are mainly three principles, three guidelines, like uses relevant information and knowledge to support delivery of evidence based patient care. So which means doing research or using appropriate resources to support the clinical judgment and evidence based decision making, and documenting patient data using standardized nursing and other clinical technologies or terminologies in order to support clinical decisions making and improvement in nursing practice. The second guideline is use of ICTs in accordance with the professional and regulatory standards and workplace policies, like by following the rules and regulations, maintaining effective nursing practice and patient safety, by following organizational recovery policies and procedures. The next one is using of information and communication technologies in the delivery of patient care by using ICTs in such a way that does not interfere nurse patient relationships, and can describe benefits of informatics to improve health system and quality of interprofessional patient care. So by these guidelines I have learned is like, by knowing these guidelines, nurses can provide better patient care, with which can be evidence based care, quality care, etc. And in week 3 I have learned why the nurses need to have a basic computer knowledge. So what are the hardware components of a computer? What are the essential hardware components of a computer? The essential hardware components of a computer are like motherboard, random access memory, uh, CPU, control processing unit, input unit, output unit, graphic processing unit, and storage unit. And what are the basic operations of CPU? So CPU is the main um, main one which operates like a fetch, decode, execute, and write back. Why is it important for nurses to know about basic computer skills and hardware? So here I have learned why computers are required for nurses, uh, in providing patient care. So by having the basic knowledge of computers, the nurses can know the main parts of the computer and its functions. So nursing, uh, this by knowing nursing informatics competencies and skills, can connect nurses to technology. By having basic computer knowledge, nurses will have the ability to retrieve, organize, process, manage data and information. Nurses can communicate more effectively and efficiently. As a nursing informatics is a growing field, all the hospitals have a modern hardware, so the nurses can provide better treatment because the diagnosis is easily made. Because here, by knowing computers, the EHRGO, like electronic health records, will have access to the uh, access to the diagnosis. So the diagnosis can be made easily, and the treatment can be given faster. So so and these computers are used to update patient records. And the overall knowing the nursing informatics, by using computers, the treatment delays are not compromised. So by knowing computers, the nurses can easily operate, and they can they don't there won't be any compromising of the treatment, as the coordination process with other healthcare personals will be a no longer waiting process, because it takes very less time to approach a physician or other healthcare personals, and nurses can give a better treatment to patient, and they can spend more time with the patient. So this is the reflection what I have learned during these 3 weeks, and it is very helpful. As a future nurse leader, it helps me in providing better patient care to my patients, and and I can take better clinical decisions regarding my patient care. Thank you.